Hello, everyone. Thank you so much for joining us on this episode of our health discussion. On today's episode of our health discussion, we are continuing with breast cancer and we are going to look at how you can actually do a self examination of your breast to detect early breast cancer. So, if you are joining us here for the very first time, you are very much welcome. For those who have been here, thank you so much. This is actually Check Your Health and Maintain Your Wealth, where we discuss health related issues, especially reproductive health and social health. So, we are going to look at breast cancer and how you can actually do a self examination of your breast to know if you can detect early breast cancer or not. Because by doing this, you see that you are going to either detect early breast cancer, which is a much more easier way, comfortable way for everyone to do. If you are clicking on our video for the very first time, please don't forget to subscribe to our channel, and also you click notification. This is such that we can continuously update you on your health issues. Thank you so much. May God bless you. So what will you be looking for as you do your self breast examination? Now we are going to point out some factors which you're going to be looking at. So if you look at these pictures, you'll see these pictures that are in some sort of a bowl-like manner. So we have from the left, we have 1, 2, 3, 4, 5, 6 of these pictures. So from the left, it's demonstrating that you will be looking for lumps. Then the next one is demonstrating that you'll be looking for a pulled-in nipple. Then we will be looking for dimpling. We'll be looking for dripping. We'll be looking for redness. We'll be looking for skin changes. So those are the various things you will be looking for as you move on to do your self breast examination. We should take note that by looking at all of these things is going to guide you towards you having a healthy breast. Because if you look at all of these things and it shows that there is an issue, then you can easily call your doctor and see how this can be handled. If it is early breast cancer, then your doctor will know exactly what to tell you. The next thing for us is actually to look at the risk factors involved in breast cancer. We have several risk factors here, and we are going to go through some of them. The more highly risk factors are tobacco. We also have unhealthy diet. We also have genetics. We also have early menses. Unfortunately, we have late menopause. Unfortunately, I'm saying unfortunately because those are things that you don't cause it as a lady. It just happened. Late menopause also, it just happened. We also have things like obesity. Obesity is something that we can control, so we should try and control that. We also have when you don't breastfeed. When you don't breastfeed, it therefore means you can easily expose yourself to breast cancer. We have also gender. As a female, you are more exposed to breast cancer than male. Now, this is also unfair, but as females, please, we need to take special note about this. Age is a factor because as you get older, your risk of breast cancer increases. Family history is another factor, meaning that for families who maybe have had 1, 2, 3 different family members who have been tested cancer positive or who have once had cancer, that is breast cancer, the probability of you having breast cancer is also higher if maybe 1 or 2 family members have had breast cancer before. So we all need to take special note about all of these risk factors, and you should take note that genetics, unhealthy diet, tobacco are high risk factors. So before you go for your breast examination, what do you need to do? You need to stand in front of the mirror, look at your breast. Why are you doing this? You're doing this because you need to be sure about the size of your normal breast. Now, you can do this maybe once every month or maybe every after 2 months, no problem. 2 to 3 days after your cycle, it will be great. So you need to stand in front of the mirror. You look at your breast to, first of all, look at it physically, how it is, so that you're very sure about size of your breast. And this has to continue, because if you don't know your normal size, if you don't know the normal size of your breast, it is practically difficult for you to actually know when it is abnormal, unless there is a very big change involved in it. But now I need to understand that knowing that your breast is like maybe round like this, or undulated like this, or my left breast may be smaller than the right breast, is going to help you when you actually do the self-examination. So you'll be looking at things like up and down nature of your breast. You also look at wedges. In our last video, we talked at these wedges. Wedges is one of the type of breast cancer we made mention about. So you also look at circles. Okay, you also examine the breast for lumps or skin dumping. You check the color or the texture of the breast. Okay, because if the color changes, maybe you used to have brown skin and now you're seeing your breast looking reddish, then you should talk with your doctor, and your doctor should be the one to tell you, hey, come on, there is nothing to worry about, or come to my office and see me. Breast cancer is so important, so we should not relent our effort to do these minor things. These are things that we can do at home, and we should not wait that until we start having major signs and symptoms of breast cancer, then we rush into the hospital to see how our doctor can help us. By doing this, you see that you are already trying to diagnose yourself at home. So once you've placed yourself in front of a mirror, look at the size of your breast and make sure that the sizes are okay. So what next? What are you going now to do such that you do your self-breast examination and come out with something that is also good for you? Because once you do this and you can actually come out with a good diagnosis of yourself, then it will help you such that you may not even need a hospital when something is right. But you see that you might be visiting a doctor even if something is right, because you don't know what is right or what is wrong. By doing self-examination, it helps you to know what is right or what is wrong. So if you already look at the sizes of your breast and you need now to do what? Your self-examination. I will encourage you that when doing your breast examination, that's the self-breast examination, you can use the left hand for the right breast and the right hand for the left breast. It is very important to do that, because by using maybe right hand for right breast or left hand for left breast, it is going to be difficult for you. Yeah, it's really going to be tough for you to handle this situation. So when you do that, when you use the left hand for right breast, so you look for a comfortable position. Possibly you need to lie down such that you use your right hand to examine your left breast with your 3 middle fingers flat. I think you can see the very first picture. A 3 middle finger flat. Move gently in a small circle. Motion over the entire breast, checking for any lump, hard knot, or thickening. Use different levels of pressure, light, medium, and firm over each area of your breast. Check the whole breast from your collar and above your breast down to the ribs below your breast. Switch arms and repeat on the other breast. After that, the next thing you need to, you look at your breast while standing in front of a mirror with your hands on your hips. Okay, with your hands on your hips, look at your breast. Put your 2 hands on your hips, look at your breast. You look for lumps, look for new changes, look for sizes, shape, and also look for any dripping. The third thing is you raise your hand, that's your arm, then reorder so that you can check under your arm for lumps. This is important because at times you may have checked your breast, whereas maybe you have a lump, something like a lymph node that are swollen, and that could be a sign also for breast cancer. So it is important that you do all of these. Like we said, doing all of these is going to help you because first, it is cheap. Second, you are the one doing it. You don't need any other person to do it for you. So you have that self-confidence to do it. Thank you so much. So we said that if you are clicking on our video for the very first time, please make sure you subscribe to our channel by clicking on the subscribe button, and also click on notification, because by doing this from time to time, whenever we post, you're going to see our articles. Thank you so much. We really do appreciate that you continue to watch our videos. Please share our videos to friends, share to family members. May God bless you. Thank you so much.